Are for-profit nursing programs helping or hurting the nursing profession and nursing education altogether? And my thought is they're doing both. Now, let's talk about how it helps. Traditional programs such as your brick and mortar community colleges, vocational schools, colleges and universities that have traditional BSN programs, they just don't pump out enough nurses, right? And there's reasons why they don't. If you want me to make a video about it, I will. But for-profit universities help fill in the gap. If for-profit nursing schools did not exist, the nursing shortage would be way worse. Okay? Now, how they hurt. A lot of these for-profit universities belong to a corporation. And at the end of the day, we all know that corporations respond to their shareholders. Now, this is not to say that you would pick one of these schools and you can pick one of these schools and not get a good education. Some of them do really well. But the thing that people need to understand is these schools are under one big brand as an umbrella. So they have these different campuses all over the United States. Not all campuses are getting the same results. All right. So you have to remember, like, a nursing program is made up of the teachers that teach at that particular program in that specific area, the hospitals that they go to do clinicals, and then where the cohort comes from. Usually they'll come from that specific area most of the time. So if you have a big box school or big brand name school, yes, everything's under that one brand, but you're very likely to get different outcomes at these different campuses. And then I've talked about this in the other video. The for-profit schools offer ease of entry, right? Usually the criteria to get in is much lower. They'll accept a lower GPA, they'll accept a lower entrance exam, or they may waive it in certain instances, right? And then they will also take more people in a cohort and do more cohorts, right? Some of them have rolling admissions. Some of them admit, 3-4 times a year, where your traditional schools only admit maybe once or twice a year, if that. And part of the reason why the traditional schools do that is because it's based on the clinical sites and availability of nursing educators, right? Remember, nurses are not the only one in the hospital doing clinicals. You have med students, you have PA students, you have nurses, you have RTs, you have NP students. There's a bunch of students in there. So hospitals have to make sure that they're providing a safe environment for their patients. Having a bunch of students running through the place increases the liability of something happening, because students are learning. What is the solution to this? If I had a magic wand, I would mandate big box schools or for-profit schools have some sort of safety net inside of their program to catch students before they fall. And I'm going to keep it a buck with you. Sometimes this safety net may be present and either the student doesn't access it or they overlook it because they always want to put their best dancers on the floor. If you know, you know.